and today we're going to be discussing how to move patients beyond fear of deadlifts in the treatment of low back pain. So for those of you that have been following the PT on Ice daily show for a while, or anybody that's gone to our lumbar management course, you know that Ice is all about deadlifts in the treatment of low back pain. And there are a couple of reasons why we believe so strongly in deadlifts for low back pain. You can go find a few of the research studies that we've discussed in previous podcast episodes that discuss the implementation of deadlifts in the rehab of low back pain. And certainly there's some evidence out there that suggests it's good. But we really like deadlifts, like I said, for a couple reasons. With anything in the human body, we kind of now know that we need to load it up. If somebody comes to us with patellofemoral pain, what are we doing? We're loading their quads, we're loading their hips. If they come in with Achilles tendinopathy, what are we doing? We're loading that Achilles. If they come in with shoulder pain, what are we doing? Loading up the rotator cuff. But what we seem to not grasp overall as a profession yet is that when somebody comes in with low back pain, just like every other tissue in the body, what do we want to do? We want to progressively load up the low back. And the deadlift is by far the best exercise there is to strengthen somebody's back. And that's one reason why we love deadlifts so much. A second reason is just the psychological impact of having somebody pick a heavy weight off the ground. If Sally's been having low back pain when she picks up her 20-pound daughter, little infant, and we get Sally deadlifting 95 pounds in the clinic, she's going to pick that bar off the ground, she's going to stand up, and Sally's just going to light up a little bit when she lifts that bar up because she's going to have this what we call badass effect. She's going to feel great that she was able to move a significantly heavy load off the ground, and it's going to make picking her 20-pound kid up seem less frightening, and it's just going to help her get over that hurdle in a lot of ways. The problem is when it comes to implementing deadlifts for people with low back pain is, as we know, they've been told a lot of bad things and come in with a lot of false beliefs when they see us. They've been told that they have a disc herniation and they should never lift again. They've been told so many things that are wrong with them. They've seen the images, whatever. There's a lot of fear around them moving, and the deadlift is an exercise that has a lot of intimidation behind it. And so a lot of people are incredibly nervous about performing that exercise, maybe more so than any other exercise we see people regularly doing. So one of my favorite things to do in the clinic right now is to figure out, how do I get people that are scared of deadlift to deadlift eventually? And so we're going to kind of talk through a framework, a series of exercises that I think are great ways to build up towards a deadlift in somebody that, say, is really, really fearful of deadlifting. Or you can also use this as a way, if you're in a clinic and you don't have a barbell and heavy weights, you're going to get some ideas and some exercises that you can implement in the clinic to get some significant loading through the low back to help your low back patients out, even if you don't have that heavy equipment yet. If you don't have that heavy equipment yet, I would recommend you can message me, the ICE Fitness Athlete Division. We actually put together an ebook for y'all on kind of our favorite strength equipment that we think that every physical therapy clinic should have, and we'd be happy to give that to you for free. It also has a large list of exercises that we think are kind of next level strength exercises that more clinicians should have. So let's dive into a couple of the exercises. I'm going to start with kind of the lowest level thing. If somebody's coming to me really, really hot and I know we're really far away from being able to deadlift, here's where I'm going to start, and then we'll progress up towards eventually ending with the deadlift. So step one for me is typically going to be just having that individual work on performing a hip hinge pattern with a dowel. So we get a PVC pipe or a dowel along the back of their spine. So it's touching their head, their upper back, and their sacrum. We work on just having some soft knees and bending through the hip, going through that basic fundamental movement pattern of a hip hinge so that that individual starts to learn those basics. So that's a pretty simple one. It's going to be tolerated by the vast majority of individuals that you see. So how do we progress up from that? Because just moving back and forth like that, there's no significant load to it. It's not going to be an exercise that really translates into improved strength. So we want to move past that. So another exercise that I'm really fond of in these really early stages of some acute low back pain or chronic low back pain that's really fearful of that back being loaded is Chinese planks. So Chinese planks are great because there's really no movement happening in the body. And so for a lot of individuals, it's the going back and forth through range of motion that kind of makes them more fearful. So a Chinese plank, an individual puts their feet on a box and their upper back on a box, and the rest of their body is kind of hanging in the air. and they're face up. So it's kind of the opposite of our standard plank. So it's going to use our hamstrings, our glutes, and our low back muscles to maintain that extended position against gravity. You can change how far apart those boxes are, even add weight onto the hips or raise arms overhead. You can do a variety of different things to kind of increase that stimulus a little bit. But the Chinese plank is a really easy way to start loading the low back in individuals. From there, bent over rows, I think, are a very underrated rehab exercise for a lot of individuals. We typically think of bent over rows or any rowing variation as a lat, rhomboid, upper back exercise. But really, if we're hinged forward in the bottom of a hip hinge pattern and maintaining that as we add the arms rowing, we're getting a really good and strong isometric contraction of those low back muscles in a hip hinge pattern. So again, similar to the Chinese plank, we're not getting a lot of back motion or repeatedly moving up and down, which sometimes will make individuals fearful or a little more symptomatic, but we're holding this sustained isometric with those low back muscles working hard to maintain that hip hinge pattern. So it is a really, really great introduction to loading the hip hinge pattern in individuals. From there, banded good mornings are a fantastic exercise. So I've got the large resistance bands that are about 4 feet in diameter circumference. I don't remember my math geometry terminology, but I'll stand on that and have that individual put the other end of the band across their back. And then they do a good morning pattern, which is simply a hip hinge pattern. But because they're using a band, when they get down to the bottom of that hip hinge pattern, the band is not loaded very heavily. So when they're in that position where they're going to be most fearful, there is the least amount of load. And as they stand up and get more upright, the load from the band increases. So it typically meets people at a stage where we're not overloading those more sensitive positions for them, whether that's actually mentally or physically. So band good mornings are great ones. Hip thrust, I'm sure a lot of you are familiar with hip thrust, but it's another great exercise that it's going to load the hips a little bit more than the low back, but it makes a great introduction, and it's certainly something that we can load up really heavy. So for those of you that aren't familiar with the hip thrust, think of it as a glute bridge, but instead of being on the ground, we have the upper back on a bench. So we're now doing a glute bridge through significantly more range of motion. That makes it a little bit more challenging, and we can really easily load this up. We can put bands around the knees. We could put a band across the hips so that we're resisting that extension. We could put a dumbbell, a sandbag, a barbell across the individual's lap to further increase that resistance. So a lot of different ways to progress a kettlebell, or excuse me, a hip thrust. And so all of those, we haven't touched an actual deadlift, but we've kind of built all the components of it, from the movement pattern to the strength needs of it. Now, when we're ready to get that individual actually pulling some weight off the ground, what's the easiest way to start doing that? I hate to admit it, but for a lot of individuals, a barbell is an intimidating piece of exercise equipment. So a lot of times jumping into a barbell deadlift off the ground can be significantly intimidating. So a much easier route to go quite often is to actually go with a kettlebell deadlift, where they're just lifting one kettlebell off the ground. Kettlebells just don't look near as intimidating. Also with the barbell, you have to kind of move the barbell around your body, or move your body around the barbell. It's a little bit more difficult of an exercise to get from a technique perspective. It requires a little bit more coaching and cueing as well. Because the kettlebell, you can kind of really walk into it really close. It's down in between your legs. You don't have to move your body around the kettlebell near as much. So it's much easier exercise to pick up on and a much less intimidating piece of equipment. So going with a kettlebell deadlift can be a great place to start. And what we typically preach in the fitness athlete division here is if you're going to go kettlebell deadlifts, let's really get aggressive with those kettlebell deadlifts. Let's get up to the point where we're pulling a 70-pound kettlebell off the ground. And then we say, hey, Doris, now let's go pick up this barbell. Now, Doris is going to get a little freaked out because now you're pulling the barbell out and she's never touched that piece of equipment before. But then all you have to do is remind her, Doris, you were just pulling a 70-pound kettlebell. Now we're actually going to bump you down to a 35 or 45-pound barbell. This is going to be significantly lighter than what you've been doing. And a lot of times that weight change will make the barbell seem incredibly less intimidating for those individuals. And then we can actually start working on the barbell deadlift. So 3 different variations of barbell deadlifts that I'll commonly use in the clinic. Number 1, the conventional deadlift, where we have a narrow stance, hands outside of the thighs. That's what most people typically think of when we're talking about a deadlift. For a lot of individuals, maybe they've got some flexion intolerant pain, like going into spinal flexion really irritates them. Maybe they have some neural tension. Pulling a conventional deadlift from the ground can be difficult. So there's two different options we can go with that will make that a little bit easier for a lot of individuals. Number one is just going to be to do a rack pull. So instead of pulling the bar all the way from the ground, we find something to elevate it a couple inches off the ground. So we're still doing a deadlift. We're just getting rid of the last bit of range of motion, which a lot of times will make it more tolerable for certain individuals. And then we can decide, do we want to progress the weight up from there, from that block, or do we want to work more on progressing by lifting lower and lower and more, getting back towards pulling the barbell off the ground. Third option for actually getting a barbell deadlift going is a sumo deadlift. So a sumo deadlift, we have the legs really wide and kind of turned out. And it's a little bit more of almost a squat pattern, somewhere in between a hip hinge and a squat, but with really wide legs. Those really wide legs, a little bit more upright torso of a sumo deadlift just makes it a little bit more tolerated by some individuals, especially those that are dealing with like a little bit of nerve tension, maybe some people that don't like shear forces on the spine quite as much, but it's a good option to get some people pulling a barbell off the ground. So there you got it. A couple different variations of deadlifts, a couple different ways that you can work on progressing individuals towards the deadlift so that you get that really awesome psychological benefit of having somebody pull a heavy weight off the ground, which just does magic a lot of times for people dealing with acute or chronic low back pain that have a lot of fear. When you get them pulling that heavy weight off the ground, a lot of things just seem to bother them and worry them a lot less about their back. So I really hope if you're not already doing it, you start to incorporate some of these exercises to get your low back patients moving a little bit better.